just gonna clean my glasses while I wait for you.
All right, so it's a wonderful afternoon for those of us who have been a regular attendee to our master class. And then, of course, today's master class is one of those really very few master class that some of us look forward to. Largely because of, again, the quality of person that is coming on board. You will want to hear his profile. First of all, I think one of the key things I'm proud of in today's masterclass is to know that this person that is coming up, it's also a Nigerian veterinary medical graduate. So he finished from UI, right? So it means that nothing is really impossible. You could finish from Usman Danfodio University, you could finish from UI, you could even finish from the newly just accredited University of Jos and do exploit worldwide. And then, of course, he practiced. You need to listen to me carefully, right? He practiced in Lagos for 2 years. Went back to the University of Ibadan to take to lecture in veterinary surgery, and then, of course, boom, he became a member of the Royal College of Veterinary Surgeon and practiced in the UK. Then also became certified by the American European College of Vet Surgeon. You don't have to don't jot now because there are times where you have to jot when he's coming, when he's fully on board. Became certified by the American and European College of Veterinary Surgeon to practice. And currently he's in the US, Atlanta, Georgia, practicing, having his own practice as a small animal surgery specialist. Of course, that's not all. He also has an MBA. You know, sometimes when you read their profile, you want to see when you grow up, right? You want to be I'm tempted to use the word exactly like them because, of course, they've achieved so much with their life. People, help me welcome Dr. Abimbola Oshin. Good to have you, sir. Good morning. It's morning. It's
Nice
6
to be talking to you today.
it's 6 a.m. in Georgia,
It's
right?
early morning here. It's 6 a.m. So,
All right. It's afternoon here.
yeah,
Good to have you on board. I'm so glad. A lot of people want to hear from you. A lot of
nice to
people
be here.
who admire who
Okay.
you are and what you've achieved want to hear from you. And then I saw comments from the advert we placed, and people saying that they definitely need to listen to you. I know Nigeria is tough, right? So sometimes people think they want to escape and then get something maybe a lot more better. You have done it, and we want to know from you how you did it and what we could also do to get to maybe where you are or a little bit more. So you have the next 20 minutes, sir, to share your screen, share your experience, let us know what it takes. Then we will now come back for the real masterclass where we will now start throwing questions at you. I'll be taking questions from the audience. We'll be taking questions from that I've jotted down also, and then we'll call it a day. So over to you, sir, Dr. Abimbola Oshin.
Yeah, thank you very much, and thank you for having me. And I'm actually happy to share some of my experiences and hopefully give some people inspiration and maybe at least give them a realistic expectation of how to proceed if the goal is to practice veterinary medicine in the US. So I'm going to give just a short overview of what this is all about. And yeah, I think I'll start from this slide. So today we're really going to be talking about veterinary practice in the USA for foreign veterinary graduates. And in talking about this, what is veterinary practice? For most of us, we think being a veterinary graduate and practicing veterinary medicine are the same thing. You know, they're really not. Being a veterinary graduate and getting your diploma just really means that you have gone through the curriculum of a veterinary faculty in any university in the world. So this university could be in the United States, it could be in Europe, it could be in Africa, Asia, whichever country, you've gone through their curriculum, you've gone through the courses, you've passed all the courses, and you now have a certificate that says you are a doctor of veterinary medicine, or you have a bachelor's in veterinary science, or whatever degree that is given to you. Now, once you have that degree, you then have to present it to a licensing body. That licensing body could be in your own country, it could be in any country in the world. And that licensing body then has to have criteria for which they will license a veterinary graduate. My experience in Nigeria is that once you're a graduate of a veterinary faculty that is accredited by the Veterinary Council of Nigeria, you don't need to take any more steps to be licensed by the Veterinary Council of Nigeria. So on the day you get your graduation and you get your certificate, or at least on the day your faculty says you have fully satisfied the requirement to get the certificate of graduation, you are eligible to be sworn in by the Veterinary Council of Nigeria and to immediately begin to practice. When I was in the UK, it was the same thing. If the Royal College of Veterinary Surgeons have accredited your university, the day you graduate and you qualify from that university, get your certificate, you automatically become a member of the Royal College of Veterinary Surgeons. Now, in the US, it's different. The fact that you are a graduate of any university, whether you are it's a US or what we call an AVME accredited university, or one that is not accredited, just graduating does not make you able to practice, does not give you the license to practice. You still have to go through a few steps in order to be able to be licensed to practice in the United States. And one thing about the United States is this: the licensure is not national. So you can be licensed to practice in the state of Georgia, but just over the border in Florida, you cannot practice. On the other hand, you can be licensed to practice in Georgia and then get a license to practice in Florida, but the day you move to New York, you cannot practice in New York. So we talk about this practice. What is practice? That is why I have that on the screen. The practice of veterinary medicine means to diagnose, to treat, to correct, to change, to alleviate, or to prevent animal disease. So to do anything to animal disease or animal illness or animal pain or any defect or injury, whether it is physical, or any other physical, dental, or mental condition by any method or mode. So I hope you can read better than I read it there. But essentially, for you to do anything to improve the physical or mental well-being of a patient, that is the practice of veterinary medicine. It doesn't matter how you do it, whether you do it with physical rehabilitation, whether you do it with alternative medicine, using herbs, whether you do it using medicine, conventional medicine, whether you do it with surgery, with manual manipulation, anything that you do to treat or alleviate physical or mental illness or injury or anything that's written there, deformity, pain, that is the practice of veterinary medicine. And it is only limited to people who are licensed to do so. Another practice of veterinary medicine, which most people don't understand, is that even if you represent to people that you have an ability or you are willing to do any of those things, you are already practicing veterinary medicine. So if you tell people, oh, I'm a veterinary doctor and I can treat your dog, and say, oh, really? Just by merely saying that you are able and willing, you're already practicing, and that can get you into trouble. Also, if you use any title or word or abbreviation or letter in any manner or circumstances that may make other people think that you are a licensed veterinarian, that is already practicing veterinary medicine. So you have to be really careful not to misrepresent who and what you are, or else you'll be guilty of practicing veterinary medicine already. So that's talking about practicing veterinary medicine. Why do you need a license? Why is it so important to get this license? The reason I think is because once you're licensed, then there's a lot of career options open to you. You can work in private practice, which is where most veterinarians end up in. And everybody probably listening to this is either a veterinarian or an aspiring veterinarian. So, under private practice, there's large animal, small animal, mixed animal, exotic, whatever you want to do, equine, farm animals. And then you can also work in the corporate world as a licensed veterinarian, because there are some duties in the corporate world that you need a license to be able to perform. You can work with the federal government. You can work in the Army or the Air Force. They have veterinary corps there. You can work in research. There are research, obviously, that you don't need a license to do. And so those are different from some research where you need license to do. But most research, you really don't need a license. There may be an institutional license, but that's directing. You can teach. Teaching clinical practice is better to have a license. Some institutions have licenses that can cover some people who are already far up in the field and practicing abroad. But essentially, it opens up a whole lot of stuff for you to do in veterinary medicine. So now the question why most people are here is, how do I get this license? How do you practice license get a license to practice veterinary medicine in the United States? Now, one thing you have to remember is that in the United States, licensure is at the state level, so it's not national. So what do you need? Most states will say you need to be a graduate of an AVMA Council on Education accredited school. And these schools are usually listed on the AVMA website. So I think all the schools in the United States of America and all the schools in Canada are accredited. Now, there are new schools also coming up in the US, and some of them, their accreditation status may not be full yet, but I'm not really up to date on that. But yeah, most schools if not all schools in North America are accredited. Some schools outside North America are also accredited. So you have schools in the UK, not all of them, but like I said, this list exists. You have school in Netherlands, for example, the University of Utrecht. I think schools in New Zealand, and I think in Australia. So there are schools over the world too where these schools are accredited. Now, if you graduate from a school that is not accredited, then you have to have successfully completed what they call an educational equivalency certification program. And I'll talk about that next. But you need to either be a graduate of an accredited school or you have gotten your educational equivalency. Now, it's only after you have that you can now go on to take what they call the North American Veterinary Licensing Examination, which is a national licensing examination that is apart from your degree. And then once you pass that, then you have to then go to each specific state where you want to be to determine if there are any other things that you have to pass. So you a graduate or you have the equivalency, you pass your NAVLE, and then you go to the state and say what else. A lot of states, that's all they require, and they will license you. Some states will have their own state-specific examination. Most of the states that have specific examination may have to do with their laws and jurisprudence, and usually they are not that difficult. But then there are some states, and I think they're getting less and less, that will give you a full exam again, practical exam before you can practice. So that is how to practice to get your license in the US. Now, I talk about those equivalency programs. What are they? These programs, I mean, you can find out about them online, but there's usually two of them. The one that's been around for the longest is the ECFVG program. This is called the Educational Commission for Foreign Veterinary Graduate Program that is administered by the American Veterinary Medical Association. That's the one I did, and it's been around. I think almost about 1,000 people go through it every year. Graduate from it. I think the last time I checked, they said they've actually graduated maybe it's not up to 8,000, because I think for the total program they say it's about 6,700 that they've graduated. But quite a few people go through it every year. And then the other program is the Pave program, which is called the Program for the Assessment of Veterinary Education Equivalence. It's an alternate program that is administered by the American Association of Veterinary State Boards. And these veterinary state boards, which are the ones that really administer the licensing, decided that they wanted to have an alternate program that is different from the AVMA, because the AVMA is seen as a trade organization. And so they felt that the licensing should really be with the equivalency should really be with the state licensing board. Um, the only thing about the PAVE is that it is not recognized by all states, but it is getting there. In the beginning, there were very few states. The last time I checked, I think 47 states um, have sort of like accepted that as a way for getting equivalency for foreign veterinary graduates. So those are the two equivalent exams. And then finally, okay, so how what does this equivalent exam, what do you have to do? I have a little chart that I try to put together here to tell you how to get to being fully licensed. So remember, the first one I said is that you could be um, from an accredited U.S. school or from an accredited foreign school. And if you have that, all you have to do then is do your NAVLE, make sure you go through the state's requirements and examinations if there's any, and then you become fully licensed. If you are a foreign graduate who didn't go to an accredited foreign school, then you have to decide whether you want to do the PAVE or you want to do the ECFVG. And all the information, because I cannot go through everything, in whatever time we're going to talk here. These are things that you have to sit down, you have to study, you have to read every word in every line on the websites so that you fully imbibe and understand what it takes, and then you can then craft a path that is usually unique to you in order to get that equivalency. So the PAVE, for either the PAVE or the ECFVG, the first two steps are the same. They need to verify that you are a graduate of an AVMA listed veterinary school, or a veterinary school in the world that is listed in the world list of veterinary schools. So most veterinary schools, if not all in Nigeria, are listed. Now, some of the newest ones, I'm not sure, but getting listed is an easy thing. If your school is not listed, just contact AVMA, they will contact your school, they will get it listed. As long as in your country, it is recognized. Then the next one is the English proficiency exams. I think there are three different kind of proficiency exams that they take. There's the TOEFL, which is the one that I did. But then there's the IETS or something like that that's administered at Cambridge. And then there's a third one. I can't remember that. I don't know whether it's from Australia, but they are options of English language proficiency test that you can take to show that you're proficient. If you graduate from a high school in the US or UK, they will usually waive that because they know you speak English already. But I think everywhere else, they used to waive it for Nigeria, but they stopped that now. Even Nigerians now have to take the English language proficiency exam. So after you do that, then depending on whether you're doing the ECFVG or the PAVE, you're going to take a qualifying exam. In the PAVE, it's called the qualifying exam. In the ECFVG, it's just called the basic and clinical sciences examination. So it's multiple choice, maybe about 225 questions in about 200 minutes. And then once you pass that, then you are ready to get to demonstrate your clinical proficiency. Now that's where it differs again. In PAVE, they allow you to repeat a final year in any of the designated veterinary school, and they will take that as your clinical experience. So you go through a final year clinical rotation with veterinary students in the US. You'll be graded as they are graded, and if you pass all your rotations, you have your clinical experience. In ECFVG, they used to accept that in the past, but I don't think they do anymore. I think now they will let you get what they call documentation of surgical experience, where you go to a practice, you perform one surgery as the chief surgeon, and then you assist in at least, I think, 4 others. And after that, then you will now go and take a clinical proficiency exam, which is usually, I think, over 3 days. There are 7 clinical areas that you have to go through. And then if you pass that, now you have the equivalent. So whichever path you take, you get an equivalent, and now you're equivalent to a veterinary graduate from an accredited university. And now you can take your NAVLE, you can take your state licensure, and then you can become fully licensed. So I think I'm going to stop at this point and see if there are, questions, or if there are things I need to respond to.
All right, so I think that's a brilliant presentation. And of course, maybe simple but detailed. There are 2 ways we're going to go about the question and answer. For every one of us watching, we have quite a handful of people online. I see comments already, so I can see all the comments. So if you have questions, you could put them on the comment box and I will be reading them out. So, but the first 2-3 questions will be coming from me. Others will be coming, I'll be looking into our comment box so that I can pick those questions out. If you're just joining our YouTube channel and you've not subscribed, I think it's a perfect time to do that. We offer quality knowledge at every time we hold this masterclass, and you will believe with me, Dr. Abimbola Oshin has been tremendously gracious to take us through what we will have paid for on a regular basis. Direct information, straight to the point, and then of course this is from somebody who has done this. All right, so you said in the UK, if your license, it covers the entire country. In the US, it's state by state. Did I get that correctly? Okay. All right. So
you got it perfectly.
The qualifying exams, how difficult are they? Do you think, from your experience, the Nigerian university, what we have gone through in our current university, is sufficient enough to take us through the qualifying exam?
I 100% believe so. And the reason why I say that is that most of the Nigerians that I know that have contacted me and said they want to do this, and I am always encouraging everybody, have gone on to take those exams and pass, because it is still the same body of knowledge that is taught everywhere. Now, obviously, you're not just going to walk in, and take the exams, just like you will not if they call you back to whichever university you are right now and say, okay, you want to take the pathology exam, you'll be like, give me a minute, let me go through my books once more. So yeah, so you have to figure out what needs to be covered. You have to get the material, but it's just a revision. So you're going to revise the things that you already know, that you already have passed, and so you just bring them back to the surface, plan your time, and then go in and take the exams. And the good thing, I don't know about every other person, but the good thing for me when I came to the US is all of the exams are multiple choice. So the answer is there, right there. In Nigeria, we're used to the essay, say, what are the pathologic features of a granulomatous reaction? And you just have to keep writing and praying to God that you remember everything. With this, the answer is there. What is this A, B, C, D? So even if you don't know it, you can know what it's not, and you can get to the answer. And the good thing, there's no negative marking. So worst case scenario, if you have to guess, you have a 25% chance of being right. So it's very, very doable.
I think that's very comforting, right? There was a lady, and just like a form of digression, I think my junior in school, and she was struggling, really struggling with her work in school. I think her CGPA was less than 1, and she went abroad, and then she became a star. We saw that she was a star. So sometimes we even think some of our lecturers make a lot of things difficult for us. It's multiple choice. It's multiple choice, and that's very comforting. So for everybody watching, I think it's not as difficult as what we think it should be. Nobody wants to victimize you. People are there to help you, and then of course multiple choice questions give you a very good room to excel. All right. So what about the visa processes? Because that's another hurdle people want to cross. You will not just walk into the U.S. So how difficult has it been to the people you've been trying to help getting and processing visas?
Yeah, yeah. Actually, it's for foreigners, that is the rate limiting step.
Oh,
Because
oh.
unfortunately, coming to take an exam is usually not, at least so far. The thing about the world is everything evolves. There's a lot of manpower shortage right now all over the world. So I'm not sure how that's going to influence government policies going forward or maybe in the near future. But as of now, saying I want to come and take an exam has not been a reason to be granted a visa to come into the US. And I think, unfortunately, unlike the medical side, where they have their own USMLE exams and you can take them in different places, it used to be held in Nigeria. Last time I checked, they don't do it in Nigeria anymore, but you can go to Ghana and take the exam. I don't know whether that has changed. As far as I know right now, it looks like you can only take the US exams in Nigeria. So, I mean, in the US. So that's another thing that you can look at that may change. So asking about how do you come into the US, mostly most people that I know are in the US either because they were born here and they're citizens and they studied abroad and now they're coming back home, or they've got into the US by other means. Either they found another job that's not veterinary related and they're here, either they won the visa lottery and they're here, either they're here because of family immigration, or either because they're here. I mean, there's so many other reasons. I probably shouldn't go into all of them, but there's so many reasons why you find yourself in the US. Now, most people, what I tell them is, just keep studying. If you know you're coming to the US for any of those reasons and you would like to practice in the US, begin your study very early, because once you're studied up, when you come in, that process can be really fast. But a lot of people, maybe they're not even practicing veterinary medicine in Nigeria. You know how we are. They're doing other businesses, just surviving, and then they find themselves in US and they're like 5 years graduates and they're like, oh, can I just sit and take the exam? I'm like, no, you have to go back and you have to study up, make sure you're ready, because then it's expensive to stay at home and study and not work because your bills are not going to stop. It's also expensive to take some of those exams, especially if you have to do them more than once or twice. So to conclude your question, yeah, it doesn't help you to come into the US, but once you find yourself in the US, that's where all this information becomes pertinent.
All right. So I think for some people are fortunate enough to have relatives, they can use that, or probably born in the US, as you heard him say, that it's easier getting. But if you don't have any of those pre-qualifications, it's also not like a totally closed doors. I think there are people who can help you through. Although I attempted going for a visa interview once, and then I was bounced. But that doesn't mean if you attempt yours, you will be bounced. You will be bounced. So just keep trying. Citizenship. How does it happen? Some people want to come and practice, and then they want to also become citizens of the US. Is that any difficult?
With the US, the US immigration system, they have their own. Yeah, I mean, it's all plain there. But essentially, to become a citizen in the US, if you go to the US, yeah, United States Citizen and Immigration Service, it's all listed there. So by affiliation, either marriage or relationship, or by work. So if you're here under any of those immigrant status, then you first of all become a permanent resident. And then after several years of being a permanent resident, you now decide if you want, you now become eligible to become a citizen. And so that's a decision you have to make. Some people decide to become citizens, some people don't. I think Nigeria is fortunate that you can be a dual citizen. I know some people who are not citizen because they don't want to give up their primary citizenship from their own country. But so once you're here for any of those reasons, you stay here for long enough, you decide you want to be a citizen, then you take the citizenship exam, you pass that, and that's how you become a citizen. But first of all, I mean, my own path was I got a job, and so when I was here long enough, based on my length of stay and my job, then I got converted to a permanent resident. And then when I was here long enough as a permanent resident, then I elected to become a citizen.
That's brilliant. So how expensive is this project? The exams? Do you pay any fee for the exams, especially the Pave, and then the ECFVG?
Yeah,
Mm.
all the fees are online,
Online.
and so once if you have the opportunity, the fees, yeah, they're online because and the reason why I said that is they change all the time. So they usually change based on
Can you give us an
inflation. They
average?
change based on you know, an average. Ah, gosh, that would be a little tough. For example, I know that it's usually around that $1,500 range to enroll in the program. And some of those enrollments are maybe for like 2 years. They expect you to go through the whole process. And then if you want to extend it by another year, then I think it's about $120 or so per year. That's just to enroll, so that they can maintain your record and maintain their offices. Then, if you want to take the TOEFL exam or the IETS exam or any of the English exams, you have to take it. They don't administer that. So those are usually in the low hundreds, if you want to take those exams, and then you submit it. The NAVLE, most of them are not big money. The biggest expense that you're going to have is preparing for the clinical proficiency exams. Those are a couple of thousands. I don't want to be very specific because I haven't checked recently, but I know the clinical proficiency exam is in excess of about $6,000 to sit for that, if you want to do that. And so you can then imagine failing that and having to do it again. So it's some chunk of change. And so in order not to do that, it just takes practice. It takes seeing a lot of practice. There are some universities that will offer short courses, like maybe several weeks long, maybe about 3 months long, to try to prepare you for the exam so you don't have to take it again. Another one that's expensive is if you go through the PAVE and you want to do that 1 year of evaluated clinical experience, most universities will charge you a full tuition for that year. So, and some universities are expensive as $25,000 a year upward. So there is some chunk of change in there. But like everything in the US, it's an investment, and if you're committed to it, and you get that funds together and you go through the program, when you come out on the other end, it's gonna be a lot easier to repay when you get a juicy good job. And there's plenty of them around nowadays.
Okay, so that brings me to my second to the final question before I start taking comments. How profitable is it? You've practiced 2 years in Lagos, and then you've practiced for a long time in the US now. You want to compare figures in terms of figures? How profitable? Will I be smiling the way some of us are smiling in Lagos? They said suffering and smiling.
So when, so when you say how comfortable, do you mean your
Profitable.
income level,
Yes, income level. Can
or
you
do
give
you
us an
mean?
average? Yes.
uh, I mean, the income level for veterinarians in the U.S. is rising and rising. Um, I think, like I will always say, all this information are on the internet. So if you Google any veterinary job in the US, it's always advertised in there. Right now, because of the manpower shortages, I mean, people are getting sign-on bonuses. that can range anywhere, $20,000, $50,000 just to sign and commit to practice with the practice. And then the average salaries are in excess of, I think right now, $100,000 per annum. So America is where most veterinarians are now getting paid based on production. So you will get a base salary, and then the ultimate salary that you make is based on how hard you work. So you can have two veterinarians in the same practice doing the same job or making different money, because it depends on how hardworking you are. If you see more cases, you do more procedures, you're going to earn more than your colleague who works in the same practice and sees less cases and does less procedures. And so you just feel that that is fair enough. So the days of a canned salary is, I mean, places where you get a salary is very few and far between. It's getting few and far between. So it's pretty comfortable. A veterinarian, you don't have to work 7 days a week. You can live comfortably working 4 days a week and taking 3 days off to enjoy yourself and your family.
And then you said, would I be wrong if I say a monthly income of around $10,000 to $20,000?
You are definitely not wrong. You're definitely not wrong. It depends on, like I say, how hard you want to work. It depends on which state you are. Everything is a little different in the US. So some states are very expensive. So you're living in California, oh, you're going to make more than that because it is an expensive state. You'll probably be making maybe $200,000. If you're living in another state, like, oh, I don't like to mention states just because this is a national broadcast, but maybe you're living in Mississippi, that may be a state where things are not very expensive, and so you're going to earn considerably less. So it's this difference between living in Lagos and making money and living in Okitipupa. And I don't know anything about Okitipupa.
Just on a lighter note, if you take an average of even the lesser amount, $10,000, that's around 4 million. I don't know if there's any veterinary practice that pays its vet 4 million per month. So, folks, I think it's worth it, right? It's really worth it if you know you want to move and then get probably better career opportunities. This masterclass is for you. As he has constantly said, you need to go online, you need to research, the rates are there, and then the informations are there. But of course, with the figures, it's calling. Right. I think it's going to be worth it. So one more question before I take the questions on the comment box. Internship. Let's say somebody wants to come to intern with you. How difficult? He's a graduate of veterinary medicine and he wants to just come and intern with you. How difficult would that be?
Okay, so the internship, or what we call clinical training programs, that is another kettle of fish that you have. It takes another research to look into. So internship positions are, they can be formal and they can be informal. Informal are just, and I've had people who are maybe like on holidays in the US, and they say, can I come to your practice and sort of like see practice. So it's not really internship, where they just hang out in the hospital, see what you're doing, ask questions, participate in some of the procedures, and just sort of like make themselves better, and then go back home and just be more comfortable and confident and more experienced in some of the things they're doing. So that's really like seeing practice. It's just like an informal internship. It's an agreement between anybody and a practice. So, and it could be any practice. You just have to be bold enough to approach them and say, I'm a veterinarian from wherever I am, and I'm going to be around for so many weeks. Is it okay if I can come in and just work with you? So that's one aside. Now there is what we call the formal internship, and these internships are actually used as part of fulfilling the requirements to become a specialist. So they are more formal. They are paid positions. They usually involve clinical training and experience that you can then use to gain further training positions, or you can take to practice to get better jobs. Now, there are two ways that those work. The most common way is that we have what we call a veterinary internship and residency matching program. So it's a program that usually open, I think, around September, October, November every year, and closes somewhere in January. And essentially, any university or private practice that has an internship position available will apply to this program, and they will advertise their internship program uh, inside that matching program. So they will say, we need 3 interns. We want them to start in July 2022. They'll be finishing in June 2023. And these are the facilities that we have. We have CT machine, MRI, EKG, endoscopy. They'll list everything that they have. They will tell you how many specialists are working with them. We have 3 surgeons, 2 internists, 1 dermatologist, 1 ophthalmologist. They will tell you the kind of caseload that they have. So we see 22,000 or 60,000 cases in a year. So they will actually advertise. And, our interns are expected to rotate through all these services or specialties. They will do so much emergency. We give them 2 weeks holiday. They will advertise in the program. So when you go to that program, you're going to see like hundreds of program advertising internships. Now, what you do is you also, as a candidate, will apply to that program and tell them, you write a letter stating your career objectives. You tell them about yourself, and, you are going to say, I'm applying to an internship program. Now, it is called a matching program because what then happens is you're going to choose all the internship program. You're going to rank them according to which one you want to go first, then second, then third, then fourth, your preferences. Now, what the program does is they get a list of all the candidates that are applying to the program, and they have to rank the candidate and say, okay, first of all, we want Femi, then we want Tunde. If Tunde doesn't come, then we want Shegun, then we want Ngozi, then we want. So they're going to rank all of you. And it's a computer matching program. So at the end of the day, when the result comes, hopefully you will get matched to the highest ranked program on your list that also wants you. And so you can see that it's very complex. Now, as a foreigner, how do you come into that? The problem is that it is very, very competitive. So from what I have told you, you can imagine that when programs are ranking individual, they're going to rank people that it's going to be easier for them to take first, either because of they're already in the US, they're US citizen, they're already licensed, things like that. I actually matched because I was living in the UK when I applied for my matching program. And I was lucky I matched to a practice in New York. And I know that it took them a while to get me the visa, to get me the work permit, and then to help me to come over to the States. So it is possible, but one of the things that I was lucky was I was able to come over to the US and do a personal interview with them. And I think that helped me a lot. I think it's more difficult to try to match somebody and bring somebody in that you've never met and you don't know. So that's the internship program in the US.
All right, so
I hope that wasn't too much.
No, that's fine. That was fine. So I can see a lot of questions and comments, but here's it. If you're watching and you've not subscribed to our YouTube channel, I think it's a perfect time to hit the subscription button. We have content. We are delivering content almost on a weekly basis that will help you as a vet, as a farmer, as an animal health professional. Then, if you find value in anything Dr. Abimbola Oshin has shared, I want you to give Dr. Abimbola Oshin a thumb up. Right, so I'll start bringing up some of these questions up one after the other. We might not be able to take everything, but we'll take a substantial part of it. Can you please avail us? That's from Dr. O.L. Mo. Maybe when you're also typing your questions, you can tell us where you're asking questions from, because these days we get questions from Nairobi, from Ghana, and then the like. So we are beginning to have a much more wider audience. Can you please avail us the website of these licensing bodies? If you could remember, well, can you please avail us? So what do you have to say about that, sir?
Well, I think the easiest way for me to do is after the broadcast, we can put it in the comments.
Oh,
And so
beautiful.
people can go and click on them, and then it will
And
take
then
them
look at it.
directly.
That's perfect. That's very good. That's very good. So
Yeah.
this is asking, of course, I know the answer. Uh, can we write these exams from Nigeria? So she typed this question when you're talking about the PAVE and then the ECFVJ. And I guess the answer is no, right?
Right now, times change, but as of now, no.
All right. Somebody's also asking, that's funny. Was it mentioned how much it will cost to write this exam? Yes, I think he gave an average. You might want to go over the video again and then check when he was talking about the fees. Temi Dayo Oyelowo.
We're gonna put the link.
Okay, that's fine. I think that will be easier. So he's going to put a link on the comment box so that you can get to know what and what information you would need to find. Can one go through all this process while in Nigeria, or you must be residing in the U.S. already? I think you want to make a comment about that.
Yeah, you must be physically in the US, whether you're visiting. And I mean, a lot of these are personal experience of mine. Most of the time when I did my all the exams, I had the opportunity to visit the US. So I visited and I took my NAVLE. I visited, and you can enroll in the ECFVG program while you're outside. So this is personal experience, which I think is one of the reasons you brought me here. I enrolled in the ECFVG program while I was outside of the US. And I went through the step one while I was outside, which was just verification of my certificate. I went through step two while I was outside, which was my English language test. And then step three, at that time, you see, things have changed. I did my NAVLE, can you believe it, in 2000. So that's 22 years ago. So it's a long time. So at that time, there was no all this basic and clinical science exam. It was just NAVLE straight. And so I flew into the US. I did my NAVLE, and then I flew out and I waited for my result, and it came out and it came out. And so I was able to do a lot outside. But then, like I said, I was lucky. I had a visa and I could come in and do stuff and go out. So you don't have to be residing, but you have to be physically present to do some of those exams, written ones.
All right, thank you. Dr. Stella Okoronko said, thank you so much, sir. Please, can you put more light on, okay, the certification and their differences? I don't know if you want to talk about that, but I know you spoke extensively about what it entails and then the differences. Just a brief comment about that.
Yeah, briefly, the ECFVG has been around longer. The ECFVG is recognized by all licensing bodies in North America. So it's recognized in Canada and it's recognized in the whole of the United States. And so that is the one thing about it. The other thing about it is usually you could have in the past you could have a year of evaluated clinical experience as part of the requirement, but I don't think they do that anymore. I think you have to take a practical exam, which, like I said, is over 3 days, and you have to perform surgery, you have to perform anesthesia, you have to do an equine lameness exam, maybe even pregnancy diagnosis. I mean, they're on top of you, you're doing post-mortem, you're reading radiographs, and they're watching how you are handling the animals, how you are communicating, and they are evaluating your technical skill as well as your knowledge and understanding. So that is ECFVG, universally accepted. There's a practical component. The other one, which is the PAVE, is more recent. It's been around for a while too, but initially it wasn't widely accepted. And like I said, right now it's only acceptable in about 7 states in the US. I think Canada accepts it, but you have to go and check. And the difference between that is that they don't have a practical exam. They require that you repeat a final year. I call it repeat, but it's really not repeat. I actually highly recommend it because, practicing in the US is different from practicing in Nigeria. And I think everybody is going to benefit from, hanging out in a clinical setting for several months so that you sort of like begin to understand and appreciate, the differences in the way veterinary medicine is practiced, and therefore you will have less problems when you yourself go on to practice. So Pave will take a year of evaluated clinical experience as meeting the clinical proficiency part of their requirements. And so that's the difference. Now, it's the 21 year in vet school, 1 year not working, and 1 year paying, like I said, tens of thousands of dollars. You have to evaluate whether that's easier for you than taking a practical exam.
Mm. All right. So somebody's saying that the
Okay.
next time he will be in the US, he's going to write the exam. So that's good to know. I know at the end of the day, we'll be asking you for your contact, your email, so that just in case if anybody wants to reach you, he can conveniently do that. Although these questions have been answered in one form or the other. Does one have to get admission first before moving to the US? That's from Fatile. I know you've talked about that. You want to say, make a comment about that, sir?
Yeah, I mean, I can. Remember, what we're talking about is getting licensed. I don't want
Yeah.
people to think that is the only thing for veterinarians to do in the US. People come here to study, to get a master's degree, to get a PhD. People come here to do some other work that does not require licensure. Maybe marketing, maybe research. So our topic today is really licensing and practicing. So if you're coming here to you get an admission to study public health or anything, I mean that's way different from licensing. But once you're in the US, if you then decide I want to get licensed and be able to practice veterinary medicine and be able to get jobs that require having a license, then you have to then switch and say, how do I get licensed? But not everything that you do require licensing.
Mm. All right. So I think we're barely having just 5 minutes to round up these. I want to ask a very funny question, right? The practice in the US and the practice in Nigeria, are they different? Yeah. Sometimes some of our vets upload some of the things they do in their clinic on their status or probably on some of the social media. It's difficult to describe what we do. Is that the same thing in the US? Is there any major difference between our practice here and the practice in the US? Go ahead, sir.
Yeah, yeah, there are, and even in the US, there are differences in practice in one state to another state, and then even within the state, there's difference in practicing in a metropolitan area to a rural area. So it all depends on client expectation and client culture, and then it also depends on obviously what they are willing to pay. So there's so many things like that that determine. So what do I mean? I can practice veterinary medicine in the US and I can practice in Nigeria because I've practiced in both places and I know what the expectations are. And even within Nigeria, I'm sure you can attest to that. When you're practicing, and I don't know anything about Nigeria, so forgive me. When you're practicing on Banana Island, it's different from when you're practicing Morocco. So it's the same thing there. So it just depends. The problem now is if you're used to practicing in Morocco and they take you to Lekki and you want to practice the same way, you may find it difficult. So it's the same thing here. If you're used to practicing in Nigeria, where when I was in Nigeria, most of the dogs are utilitarian. They sleep outside. You wash them with a hose. and all of that. And then you move somewhere else where, the dog is a member of the family. He sleeps right between daddy and mommy every night, and then you want to handle them the same way, you're going to run into problems. One of them, you can use the lasso to catch the dog and just jack him, and the other one, you have to hug the dog. Because you cannot handle it because he's not used to that. So and so yeah, so to me, those are the differences. It's just coming in. Practice is an art and a science. The science and the knowledge you have, but then what about the art? And then the equipments are sometimes different too. The equipments that you have access to, maybe things you've read about that you've not used, so you've got to find time to use them, to get comfortable with them. And so there are different reasons why the practices are different, and it's different for each individual depending on what their past experience is. Some people will come and fit right in, and some people will come and it's a culture shock.
Really a culture shock. I'm going to ask you for your final advice, but before I do that, if you're watching our YouTube channel and you've not subscribed, I think it's a very good time to hit on the subscription button so that subsequent videos, informations like this, that I think are really very valuable in enhancing your career, you can pop up on your screen and you could be part of it. And of course, if you've not given Dr. Abimbola Oshin for this brilliant, amazing presentation, straight to the point, ideas and thoughts he has shared with us, I think it's the right time to hit on the thumb up button so that more of this video will cascade to more vets and more animal health professionals. I think if we can drag each other upward, the better for us in the profession and then the better for us in the society. Dr. Abimbola Oshin, usually from this type of broadcast, we have an average of 200 to 300 or 400 vets watch this episode. I think this is going to get up to 400. We have over 1,400 subscribers now. So you have an opportunity to be part of our lives. You have vets watching you. What words of encouragement do you want to say? People, sometimes, it could be difficult. People think you're far off and then they are down there. But again, I think everybody can start from wherever he or she is and move up the rank of the ladder. And that's what I really want you to spend the last 1-2 minutes saying, encouraging us, and then giving us your own final words of advice. Go ahead, sir.
Well, the advice I give is one that I've always given, and it's usually that whatever you are doing, wherever you find yourself, just always strive for excellence. Always strive to be the best. It doesn't matter what you have available to you or what you don't have available to you. We all have the same thing inside of us, but we're in different circumstances and in different situations, and all you can do is be the best in that situation. And for those who aspire for better, the advice I always say is always study and prepare yourself, because one day your chance will come. When that chance comes, the worst thing that can happen is that you're not prepared.
Oh.
And chances sometimes will come and then they will go while you're preparing, but if you're always prepared, if you're always the best, whenever that chance comes, you will already be there. Passing an exam does not make you better. It only shows what you already are. So you're already a great person. You go to the exam, you pass. You're not prepared and you're not very excellent. You go to the exam, you're not going to pass and then become excellent. No, it only shows you what you are. So be always prepared, be the best you can be, do whatever you can to stay up to date, journals, books, discussion, watching programs like this, YouTube. I mean, gosh, I wish there was YouTube when I was growing up. You can learn so much online and really, really be the best that you can be. So that's my advice.
Wow, it's been a hell of a time, and I think I had a lot of moments where I just sit back and then contemplate and then also reminisce about a whole lot of things you bring to the fore. We know Nigeria is upcoming. We know the US also, it's slightly better than what we have. but there's every chance to improve. Improve the profession, improve the practice. And we want to thank you heartily, right? It's 6 a.m. We started this program when it was 6 a.m. in Georgia. And for you to wake up, sacrifice your time, it shows how interested you are in our career, in our growth, and more importantly, in giving back to the Nigerian community that you emanate from. This we do not take lightly, and we are so thankful to you, and then of course to every thing around you that has supported you in coming up to this program and sharing the lights that you've shared. To every of our viewers who is watching you a vet, I want you to promote this video. Let more vet listen. As I said initially, a candle doesn't lose anything when it lights up another candle. Together we will bring up the face of the profession. We will rise, we will improve the profession, we will make it better, and then ultimately we will be proud at the end of the day that we contributed the bit we can to the upliftment of the profession. Dr. Abimbola Oshin, thank you so very much. We are grateful. We will keep on knocking at your door, especially when it relates to small animal practice and then, of course, your experience with the industry. Thank you so much, and then have a wonderful morning. And please don't forget to drop the link at the comment box so that a lot of us can find value in whatever you will share subsequently. Have a wonderful day, sir. Thank you. Bye.
Thank you.
Yes, sir.
Thank you.